hate doing the intro.
Oh, dang. We could alternate then.
Okay, you start
Oh,
this time.
um, here's a good even. Good
The,
day, people. This is Point2Point. I'm Tony Yam, and my friend here is Robert. Today we're going to talk about cancer, right? How
Yeah,
TCM
TCM and
treat
cancer.
or well, it's very hard because we really cannot say too much about acupuncture treatments, treating cancer, but other than the symptoms. Think yesterday I had a patient's call the clinic. My receptionist, she picked up, and she had to bother me in the office asking me, is somebody who asking questions regarding acupuncture treatments. Like, okay, so why? Do we treat cancer? Like, oh God. Cancer is very hard things for me because I don't normally or I don't treat cancer at all.
We're
So I
not
spoke
supposed to.
Yeah, I spoke with the patients over the phone. I did not ask him like what type because you need to have special herbs too,
Mm.
not just the needle. I spoke with him on the phone. I mentioned it. Mm, I Acupuncture is really help relieve your symptoms like the fatigue, certain pain, insomnia, or stuff. But I told him that it's best to go to my the other clinic that have herbs. I explained to him that it's best to use acupuncture and herbs, supplements, or formulations to help with his cancers. I really don't have much experience with cancer other than helping with pain. A couple of times I have vomiting like few times, not a couple of times. The person who's actually very tired, especially low on energy when they had chemotherapy
Yes.
and they had a lot of pain. So actually acupressure helps a lot
Hmm.
because the muscles sometimes they get real tense and nervous and fatigue. Since they don't sleep well, the pain is increasing. So we do acupressures on the patients. It helps them relieve not just the pain, but it's also mentally. People who have a lot of those chemotherapy, their minds it's not there because they're really upset and depressed. By doing acupressure or acupuncture, literally you're supposed to stay in there and talk to the patients to help them feel more relief. They probably don't have much people who listen to them other than the doctor say, okay, here's this and this. Okay, send you to the chemo. How you doing? How you feel? Okay, good. Goodbye.
Yeah.
Um, the mental part is important. Also, remember when I was an intern in herbs class, course, clinic, I'm sorry. There's a lady who's in stage 4 gastric cancer. I don't know, stomach maybe? I don't remember which part.
Hmm.
Wow, I think stage 4. We treated her with herbs and acupuncture to relieve her symptoms. I did not realize she's in stage 4 if she never mentioned it. Why is that her spirit is so high? She every time she show up in clinics, she got a big smile on her. She had problem with eating because due to chemotherapy, but she still eats. She
Hmm.
tried her best. I guess the mental part is most important. For us to treat patients, we have to make sure they're comfortable with the treatments. And by talking to them, it's actually connecting them to us, the provider, the practitioner. We want to know what's going on with their lives. Again, chemo, losing hair, especially for women, it's not a great thing. They probably feel more depressed for that too because of the hair loss. So we try to listen, try to comfort them, try to make some suggestions like what kind of food to eat that is less greasy and less heavy, something simple. But that's my experience. How about yours? Sure.
There's a lot to go over here. It's funny that you mentioned that person from student clinic because I remember her very well. I was the one that made up her herbs every week. So
Yeah.
I had very long conversations with her. She did very well for quite a while, and she actually I wouldn't say she was deemed cancer free, but she was in remission for several years.
Mm-hmm.
Okay, I believe you saw her when she came back again.
Yeah.
Um,
Yeah.
I think she was in remission for like 5 or 6 years. And then all of a sudden they found it again, I believe in the intestines. But I remember that was the one of the first times that we actually had the powder type herbs. Because I used to make the whole big herb uh, bag that I cooked inside of the
Oh,
pressure
I
cookers
remember
that
those
we had.
bags, those pouch, those big
Yeah.
ones.
She talked a lot about the chemotherapy and things that she went through in the early part of it, anyway. My own teacher actually created a formula for people to take during that stage when they're treating with chemotherapy. It
Mm-hmm.
actually helps them to keep their energy up because it's the chemo itself is very debilitating to the body.
Mm-hmm.
I mean, you're literally destroying it.
Everything. Yeah.
They've gotten much better over the last 15 years since we first saw her. They can pinpoint a lot better, but even back in the day, sometimes like, oh, we're close enough. You know, the thing is, the formula kind of helps in a secondary way because it has kind of like an immune system booster.
Mm-hmm.
Allows the white blood cells to clear out all of those dead cells
It
quicker.
helps. Yes.
Many moons ago, I remember someone at work whose mother was very frail. But she always talked about how hard it was for her to move around, and she had cancer as well. She literally passed away after the first chemo treatment.
Wow.
Now, I don't really want to scare people and, well, maybe I shouldn't get chemo. You should always, and again, what we talk about here, this isn't medical advice. We're just talking about our own experiences with it.
Yes.
Once again, in relation to acupuncture, on my insurance form that I have to pay, there's literally a spot there that says, "Do you treat cancer?" And you have to say no. We don't treat cancer, we treat the side effects of cancer.
Mm-hmm.
When it comes to herbs, though, herbs aren't covered under the insurance. So that's all right. That's food that's what did they call it? They call it food
Supplement.
therapy. But there's a couple of things also that I wanted to talk about. First, you said that you did acupressure inside of the clinic with any of the cancer patients.
Mm-hmm.
I completely 100% agree with that. One of the things that I've learned from many of the old books is you don't want to give acupuncture to
Mm-hmm.
someone who is tired
Maybe.
or fatigued because it has the opposite effect. It makes them worse. Your body's trying to use its own internal
Mm-hmm.
processes to be able to help the function when you use
Mm-hmm.
acupuncture. And if you don't have that, if you're fatigued, if you're tired, your body's not going to be able to have enough to be able to increase the function. You're just going to make yourself more tired. Acupressure,
Oh
everybody
yeah.
loves massage. Everybody loves massage.
So
Herbs,
I'm sorry. I
go
just
ahead.
to ask the viewers Oh, this how many people, how many acupuncturists just remember that you don't treat people who are very tired and fatigue.
Not a
I
lot.
a lot of people forget about that part.
Yeah. It was listed in the Huangdi Neijing, specifically within the uh oh, I'm sorry, it's in the Ling Shu. Many, many moons ago, I read this really big textbook specifically for the Ling Shu. He had a specialty of doing something called Ling Shu acupuncture. It was
Mhm.
very, very interesting book. He, I found that he was very, very difficult to speak with, though, because anytime you had a question, it just says, "What does the Ling Shu say?" Yeah, but if we don't understand what the Ling Shu says, we're not going to understand what the point of it is. But neither here nor there. I'll probably cut this out. It's still a very interesting read.
Yeah.
Uh, it's just another point of view on some of the older books. But that's something that I do agree with. You really shouldn't do acupuncture on someone who's tired. Herbs have a much, much better effect. We're talking about cancer. So in the student clinic, I saw a lot of gastrointestinal cancers. I saw one person with brain cancer, and I believe another with, I want to say, breast cancer and pancreatic cancer. We had a very good rate in helping people with gastrointestinal cancers because there's a lot of research in herbs specifically for apoptosis, for the digestive tract cancer cells.
Mhm.
You can look them up online, and it's funny because they're finding new ones. Even like a couple of years ago, there was a new one that just came out. There was a study done. I don't remember it off the top of my head. I'll probably place it up there if I find it. Uh, One of the things that you need to remember is you just can't take one herb and think the cancer is going to go away.
No.
That's kind of a misconception with most people think about just herbal medicine in itself. There is a process, there's a formula, there's theory behind the entire thing, and it's custom tailored specifically towards the patient.
Mhm.
One of the things I believe someone mentioned to me is, oh, I can just take a patent herb and I'd be fine. No, patent herbs, even generic, are just they're not really that strong either.
Even though they say the concentration is like 10 times more, but really you need the ingredients or those chemical
Yeah,
reactions to cook them together, to decoct them. That's why ancient time they brewed them or cooked them, decoct them for a reason. Even though they taste disgusting,
yeah,
but that's what they've been doing back then. So we have modern technology nowadays because people don't like to drink herbs because it tastes
yeah,
disgusting. So they make into a pill. But these pills, I I took these padding herbs. Really, I don't feel any effects. I'm like, okay, I've been taking this for a month or two. I'm like, really, I don't notice any difference.
yeah.
It-
I will say this: the herbs for cancer are not bitter. So they're not going to have to worry so much about the
yeah,
taste.
it's
It
good
might
news.
be very earthy and grassy, but
Makes sense. So,
one of the
mm.
things that we used to tell the patients, if you can't take it, use a straw because you can put the straw
Oh,
further
wait.
back on the tongue so that you don't actually have the taste. You
Hmm.
can just and do it right in. And it's funny, but again, going back to that patient from before, when we used the cooker, we used to put them in bags about
Yeah.
yay big. And it was just easy to snip the top off, put a straw in, and then you could just suck the whole thing down. And it was very nice because once again, it was cooked. We had the reaction, everything was there. The second time she came in, that's when we started with
Uh,
the powder itself, the granules, the concentrated granules. And it was interesting because the formula that the teacher had given us was larger than the dosage, even at 5 times the amount that she could take in a day. So even if I made the capsules, which I believe was like 9 capsules 3 times a day was the normal amount,
Mm-hmm.
she had like double that.
56
54, if like 50, like 54, 55 pills a day. That's too much. But
breakfast, lunch, and dinner.
you could just use the scoops and put it down. The other thing you could do is one of the nice things about the granules is you could just throw it back into water, stir it, and it would make the
Mm-hmm.
tea. You're kind of missing the reaction for it, but I will say this, there were a couple of herbs that we weren't able to find in granule, but they did have as dried herbs.
Mm-hmm.
And a couple of them were cancer herbs at the time.
Yeah.
Well, I shouldn't say that. A couple of them were used for treating cancer-like symptoms at the time.
That's true. We have to be careful what we say. It's not those special lawyers knocking the door.
Yeah. I will. There was one thing I think, and I do want to at least throw this out because it's a very interesting story,
Mm.
and I'll explain why I'm saying it in a second. Early in my herbal clinic, I think it was the first year that I actually started as I'll say a temporary physician in the clinic. There was someone who came who was given 6 months to live because brain cancer.
Mm.
They didn't even want to treat her anymore. So she was kind of desperate, which is why she came to the student clinic. She didn't have a lot of money either. Most of it just went into her treatment. And when they finally said, oh, there's nothing else we can do for you, you have 6 months to live. Have a nice day. And that was it, which is devastating to hear. Absolutely devastating. I was in the herbal clinic at the time, and the teacher wrote up this very interesting prescription. I'm not going to list what's in it.
Mm-hmm.
Some people would find it disturbing, but for most TCM practitioners, some of you already know which herb it is. And he created an entire formula just for her. And he said, "Here's what it is. You need to take it when you run out. Just go back to this particular place and they'll refill it for you. They'll create the formula again for you because we didn't make it for her because she didn't have the money for it." He says, "This is what you need. Bring it over to this facility. The facility will make up the teas for you, which is cheaper than what we had," which I
Yeah.
shouldn't say. Um, Lo and behold, 6 months later, she came back. Most of the cancer was gone. And he was completely in shock. He says, "It's been 6 months. I haven't even heard from you. What happened?" So she gave the whole story. She did the regimen every day, ran out, went back to the place and got it. And one day her headaches disappeared. It's like I've had headaches my entire life, and it was worse when the cancer grew. Now all of a sudden they're gone. Am I finally dying? No, she went back, had a CAT scan done, or they had shrunk so much that they were almost gone. The She went back and she spoke to the doctors, uh, who told her she only had 6 months to live. And this gets me the most. They basically congratulated themselves on what a great job they did in removing the cancer for her.
That's not new. Hey, because of us. Yeah, yeah.
Sad but true. But she did continue to take the herb. She came back another 3 months later, and that's when she said that she was finally cancer free.
Wow.
She was crying the entire time. She was so happy. She's like, "You gave me my life back." you know? And it's a wonderful thing to hear that there is some type of hope for people. So here's where my I lose my faith in humanity because there's more greed in the world than there is uh, hope. It bothered me that the general medicine population kind of failed her after they said that there was nothing else left that they could do. And desperate to stay alive is when she came to Oriental medicine practitioners to say, is there anything that we can do? I used to joke that there were three C's that you could never say in TCM. First one is cancer. They never want you to say anything or do anything about cancer. The second is cure, because we don't cure anything. And tell you the truth, even Western medicine's not supposed to say cure either. The third one is collaboration. They don't want any of us working with anyone else in the Western medicine field, or they don't like it when we work with anybody else in the Western medicine field. Had we been working together with her at that time, we would have never gotten to this point. Even with all the other people that I've seen with digestive tract cancers, a lot of that stuff could have been caught first stage, second stage. There's a lot of non invasive ways of treating that. Yeah, they can use chemo with it, but think about it, which is better? Chemo along with the formula that we came up with to help them keep their energy, move the dead cells out, you know, you'll get a better prognosis working together than you will just saying, oh, okay, you have cancer, great, off the chemo.
Well, that's the things with the treatments you will consider holistic
Yes,
treatments where you put them all together. To me, I mean, in our school that we learn, most of our professors saying that there's no such thing one treatment is better than the other.
correct.
We have to be honest. TCMs with, and Western medicine, Eastern West medicines and Western medicines should be combined into one concept medicine. The reason is that we had to combine it because it's like yin and yang. Some of them is good with Western medicine, it's quick to treat, relieve the symptoms right away. In contrast to Eastern medicine, which take times. So with the Western medicine, most of them have a lot of side effects,
Yeah.
where the Eastern medicine helps relieve the side effects. Really, that we're supposed to be together, working hands to hand to benefit the community, people, friends and families. I hate to say patients. It's just really friends and families, because we have to have some compassions. They're not just a patients with numbers and
Yes.
dollar signs.
They're people.
They're people. And the major thing is we have to understand them, talk to them, listen to them. Always give some hope. Some people will say, oh, there's no hope. Why you want to give them hope? It doesn't cost anything just to listen and to the
And
time. I know some doctors say, hey, I ran out of time because of the insurance things,
yeah.
but I
Sorry, you
believe
have 6 months to live. I can't help you anymore. Goodbye. Yeah, that's very hopeful.
to me that some of those doctors they don't know what's going on.
That
They
too.
reach to the end of stage. They a lot of them they follow protocols. Hey, I never learned this, and this protocol stop here. I'm sorry. I'll get in trouble if I do something else with you. A lot of people also, a lot of doctors might be afraid that, hey, I could treat her, but if she passed away, my reputations will go down. A lot of hospital out there, they refer patient out They claim they're like number one for cancer or the heart
Yeah, I was going to
centers
say
and
the
stuff.
heart. Yeah, the heart hospital. Yeah.
They do refer patient out once they find out, oh shoot, her case is very complicated. When I was working in nursing homes, or even like current clinics, some patients saying, wow, this hospital that uh, let me tell you a story. I used to work in a nursing home, and this patient, I treated her for, of course, pain that time. But she was talking to me. Oh, I was get kicked out from the hospital. I'm not going to name names because they will come after me. Even though the patient mentioned that, it's not me, it's her. But anyway, she was treated for I think special with the heart problems. So she went to this hospital in the city. It's very well known for the heart hospital. So they try to treat hers, but they think her case is very complicated because she doesn't get any better. So she get discharged from the hospital to nursing home. The most outrageous things that the hospital done is to kick her out by using ambulance, not ambulance. Ambulance is not certified. There's no EMT technicians or paramedics at all.
Mhm.
It's just a driver transporting her. So this hospital did not take her vitals. You were supposed to take the vital to make sure
Mhm.
she's okay before the transporting, and she feels dizzy. She got feel lightheaded. She doesn't feel well. It's because they probably misdiagnosed her too. So the driver of the ambulance, he was nervous because I think there's a blood pressure machines or something. He found out that her blood pressure is so high, it's to the roof. He got a cold sweat. He told the patient, I feel very uncomfortable transfer you to the nursing home. So the patients felt like, what the hell? Why the hospital is kicking me out when I have these problems? And this driver feel uncomfortable transferring her. Why? It's because he cannot do anything for her if something happened to her.
Yeah.
She could have stroke or hematoma or anything because they don't know what's going on, or they know that her blood pressure is so high, but the hospital refused to let her stay there. Most likely, what she explained that if she passed away in the hospital, so their name, their reputation will go down the drain too. So they really want to kick her out. Somehow, this driver and the patient were lucky. So the patient made it to the nursing home alive. Then, of course, the nursing homes they had to intervene. They had to get some doctors to check on her, what's going on. So by for her talking to me is a good sign, saying, "Hey, she's still alive." So she shared that experience with me that either a lot of time our society like greed and their reputations, their popularity is all on their minds. If I cannot get the money, but at least I keep my name. There's a lot of practitioners out there thinking about that, but we have to remember why we in medical field, why we go to health field. Chinese sayings that when you treat, you have to have the heart, the compassion of a mother. That's traditional old saying,
Mm.
but that's a reason. It's not easy for us to be a practitioner. Sometimes a case is very hard, we cannot handle. It's okay, but you have to refer to the right people. I'm not God. I tell patients, I'm sorry, I don't know how to do this, but I can help to try. If I cannot, I will refer you out. Just be honest. We don't know everything. If we know everything, we will not be practicing anymore. Why? Because you're gonna have somebody doing the work for you. So the major thing is, as a practitioners, we should. I cannot say have to because it's all your own. That's my opinion. We have to show some compassion. We have to use our heart to heal. Money is important, yes, I know that, especially right now. But still, sometimes you could brush it off. Doing some good deeds make you feel better too. But at least if I die, I can say, hey, at least I did some good deeds in life. At least I try.
Well, trying's better than most people.
Sometimes it's very hard. We're so busy. We're like, ugh, ah. So what other people think about the cancer thing? Remember, we only treat the symptoms. Please don't put your business card. I know some acupuncturists out there. Hey, I treat this outrageous cancer. It's like, what the heck is this? I remember reading newspaper. One, this person is BS. Okay, you're not medical workers. But good thing is this in Chinese. Even in English, you're getting sued right there, or you get in trouble right there. Yeah, you cannot cure it. We cannot put cure in a business card either.
It's not 100%. Once again, it always depends on the person too. There is no one answer to everything. And that's kind of where general medicine doesn't realize is that you can't just take a chemical, turn it into a pill, slap a name on it, and give it to someone and think that's going to make everything go away. Especially when it happens in regards to cancer. There's usually more than one reason for it. To them, there's only one way to treat it, and that's basically, when you have a hammer, everything looks like a nail. It's not the right tool. It's finding the right tools to help with the problem. And again, since everyone's different, you need to use different tools, whether it's whether it's herbs, whether it's chemo, whether it's drugs, whether it's acupuncture, acupressure. There needs to be, as you said, a more holistic approach towards it. Uh, even foods have a great deal uh, in helping with certain cancers as well.
Oh yeah. All right, please subscribe and click likes if we have likes, thumbs up, no thumbs downs. And we'll see you next time.
Thanks again.
Thank
Let's
you.
see.